Myself, Dr. Kirthi Paladugu, Consultant Joint Replacement and Arthroscopy Surgeon. I am here at Yashoda Hospitals, Hitec City, Hyderabad.
So, welcome to the program, doctor, and it's a pleasure to have you.
Same here. Hello.
So, being an orthopedic surgeon, joint pain is a common symptom that most of the patients come to you. So, one what goes through your mind?
No, more than when they come and tell us we have a joint pain, our examination starts the way they come into my OPD, the way they get off the waiting chair, they walk into the OPD, how quick they are off the chair, how fast they are walking. Based on that, we come to a conclusion in what grade they are in, and also based on the age group again. The younger population, we think more in lines of what you call ligamentous injuries, soft tissue injuries, or early arthritic changes kind of a thing. The more elderly they go, we should think in two lineages. One is arthritic changes into the joint. The second one would be the neurological problems or even the vascular issues what we see.
So, you silently judge people by the way they walk or they carry the bags, or silent gum even when you're outside?
Judging is a very big term, and most of the people don't like that term of judging. I examine. I call it as I examine it. And probably, yes, even when I'm outside, my mind goes that way. When I see someone walking with a waddling gait, I feel she might be a candidate for a knee replacement, especially the older people who will be walking in the lobby of my apartment or in the shopping mall. My mind goes there.
So, joint pain anangane chala mandi bhaypadtaru. I have to go visit an orthopedic surgeon, and I'm sure na knees kani, a joint avagani, they'll be replaced. Is that true?
That is the biggest problem and the biggest myth we have with the Indian population. మన దగ్గర జాయింట్ పెయిన్ అని భయపడే చాలా మంది లాస్ట్ స్టేజెస్లో వస్తారు, డిలే చేస్తారు. గ్రేడ్ 3, గ్రేడ్ 4 కన్నా ముందు రారు అసలు. ఇదే ఉంది చిన్న నొప్పి, దే బేర్ ఇట్, రైట్? ఇట్ మైట్ బి మై మదర్ ఆర్ సమ్వన్ ఎల్స్, ఇట్స్ ద సేమ్ థింగ్. వాళ్ళు వచ్చిన స్టేజ్ బట్టి విల్ బి టేకింగ్ ఏ కాల్. సో 70-80% ఆఫ్ ద పీపుల్ దే కమ్ అరౌండ్ గ్రేడ్ 3, and we see around 40-50 OP in a day, and we don't tell surgeries for each and every patient. My first thing, most of the people will ask what they ask us is, ఎక్స్రేలో పూర్తిగా అరిగిపోయిందని చెప్పారండి, మరి సర్జరీ చేయాలా? ఫర్ మీ, ఎక్స్రేలో అరిగిపోయింది, గ్రేడ్ 4 ఉంది, వంపు వచ్చింది, అన్నీ ఉన్నా సరే దట్ ఈస్ వన్ ఆఫ్ ద ఇండికేటర్ ఫర్ సర్జరీ. బట్ ద ప్రైమరీ ఇండికేషన్ వుడ్ బి హౌ మచ్ ద పేషెంట్ ఈస్ సఫరింగ్ విత్ ద పెయిన్, వాట్ ఈస్ యువర్ డ్యూరేషన్ ఆఫ్ వాకింగ్, what is your ability to stand and do your household activities, and what are you expecting after surgery?
So, simple ga cheppalante, surgery is not always the choice. You can also, preserve your joint and delay the surgery antara.
Surgery is the last choice. Even being a surgeon, if you ask me, surgery is the last option what I take. The reason why I'm putting my scalpel on them. So first is always with the physiotherapy, exercises, medication. And to an extent, if the patient is indicated something like they are in a grade 3 or grade 2 arthritic changes, X-ray doesn't look really bad, but the patient pain coefficient is significantly high. These are the candidates in whom we'll be even trying intra-articular hyaluronic acids, PRPs, stem cell therapies, and all those things. At least the patient is suffering from last 6 months to 1 year. They have tried all the modalities of treatment like exercises, physiotherapy, medication. Rest of things has been tried. Even then, it's not relieving, and you are being supported by the painkillers, analgesics. They are the cases whom we should operate.
So, when you consider put a joint replacement is the only way to go about, what are the fears or what are the general myths which are associated with the surgery, doctor?
The first and foremost and the true fear what most of the patients will be having is the pain post-surgery. And they are rather than the surgery, they are more scared about the physiotherapy part. With the advent of the techniques what we are doing now, with the advent of the instrumentation, and with the advent of the newer technology like robotics and all, and even the pain medication, the way anesthesia is being given, so post-operative management has become much more easier nowadays, and the amount of pain what they are feared of is definitely low.
So, following the instructions of the physiotherapist and also the doctor is very important after surgery for the best outcome antara.
The outcome varies from each and every individual. That is again based on how well you are doing the exercises, what is your willpower to get back to the work or your daily activities. Based on that, it will be subjective. And we are here definitely to motivate that, and our physiotherapy team will be taking care of them. We have a habit of following them up. Someone is doing on the slower side of the exercises. We get a video of them. We see how they are doing the exercise at home. If we feel is a bit sluggish, we'll ask them to come to the department, do the physiotherapy, guide them through how it has to be done, and I just send back and we'll reassess again after a week or so.
So what are some lifestyle modifications that one has to follow after surgery which are non-negotiable antaru?
From my side, it will be not to sit on the floor. Most of the Indian population, what they ask is, can we sit on the floor? Can we sit cross-legged? Because when you bend more than 90 degrees and get up off the floor, your legs are locked and the entire pressure falls on the knee. That is the reason why we tell not to sit on the floor rather than sitting cross-legged. That is the only thing what we request. Exercises, there's no limitation for that. Carrying weight, these are the common questions what they ask. There's no limitation for that. Staircase, there's no limitation for that. Tirupati Metleki digina vallu kuda we have those patients.
So I think that's some incredible journeys what you have really seen in patients' stories. I think that's something really inspiring and that pushes you every day, I believe.
Definitely, when my biggest happiness what I had till date was I did operate around 40-year-old female. She was a resident of Anantapur. Very bad crippling rheumatoid arthritis. She was so bad that she had to carry to her washroom for her daily activities. She was that bad with her joints. We have operated her, both the knees at the same stage. And then when we made her walk, and she was a badminton player. She was representing badminton in her younger days. And the first statement what she told was, after 4 years, I am on my legs and I'm very happy for that. Hearing that, it made us so happy. That is the biggest thing what I will never forget in my life. Most of the patients will be asking like, will you be able to walk and all? I simply tell them, whatever activity levels are now, minus 10 years, how are you 10 years back? That is what we are going to give you if you are following the rehab protocol.
And what more can you ask for? So how do you avoid basically, or how do you delay joint pains, especially? What are some tips that younger generation should follow?
The most important thing what we ask most of the patients would be to do your quadriceps strengthening exercises. Quadriceps is your thigh muscle which needs strengthening, and it's a continuous process. Second thing is any injuries that has happened in your younger age, either it can be an sprains or some ligamentous injury or some accidents. Rather than neglecting, it's better to take an opinion from your nearby orthopedician or your family doctor and go across with the rehab protocol, and what all to be done, it has to be done very in a meticulous and a precise way.
And finally, doctor, what are some healthy tips that you would recommend everybody to follow? And what is that one message you would like to share with the viewers out there as far as joint preservation kanivandi or joint replacement kanivandi?
For the entire system to reboot itself, have 8 hours of sleep, which most of us, we are not able to do that, including me. So that is one thing what I request everyone. Second thing is, coming back to the joints, stretching and strengthening. So rather than spoiling it or damaging it and then coming back and doing the exercises, have an habit of doing the strengthening exercise and stretching of the joints every day for 5 to 10 minutes of your type. That should be good enough to preserve the joints and have better mobility. And also the longevity of the joints would be better.